What is it like to live with sickle cell disease? Sickle cell disease is a disease of the blood, particularly the red blood cells, which affects hemoglobin, the protein that carries oxygen to the body. People with sickle cell disease have a different hemoglobin, called hemoglobin S. It is an inherited disease transmitted from parents to children and affects both men and women. When the hemoglobin S gene is inherited from only one parent, that person will have incomplete sickle cell disease, or sickle cell trait. People who have sickle cell trait are usually healthy, but they can pass it on when they have a child. When the hemoglobin S gene is inherited from both parents, this person has complete sickle cell anemia, will have symptoms and will pass it on when she has a child. Red blood cells containing normal hemoglobin are disc-shaped and flexible so they can move easily through large and small blood vessels to supply oxygen. Red blood cells that contain different hemoglobin, in situations where the oxygen level in the blood is lower, lose their flexibility and become rigid, taking on a crescent or a sickle shape. These red blood cells do not bend or move easily and can block the flow of blood to the rest of the body, causing pain and organ damage, and they can also break. People with sickle cell disease can suffer from pain crisis and other complications. You can follow these steps to help relieve symptoms and reduce the chances of serious problems. Adopt a healthy lifestyle and avoid the triggers of pain crisis. Get regular physical activity. You may tire easily, so watch your pace and avoid very strenuous activities. Choose healthy foods, including limiting alcohol. Drink more water to avoid dehydration. Stop smoking. Avoid situations that could trigger a crisis. Extreme heat or cold, as well as sudden changes in the temperature, are often triggers. When you go swimming, get into the water slowly rather than jumping straight into the water. Do not travel in an unpressurized aircraft cabin. Learn to manage pain crisis. When an acute crisis is starting, drink plenty of fluids and take a painkiller. If you cannot control your pain at home, go to your hospital for additional, stronger medications and intravenous fluids. If you experience priapism, prolonged and painful erection, you may be able to relieve your symptoms by exercising lightly, emptying your bladder when you urinate, drinking more fluids, and taking the medications recommended by your doctor. Seek help if you have feelings of depression or anxiety. Supportive counseling can help. Know when to seek emergency care. Symptoms of severe anemia, including extreme tiredness, fatigue, shortness of breath, dizziness, or irregular heartbeat. Splenic sequestration crisis or aplastic crisis can cause symptoms of severe anemia. These conditions can be life-threatening. Fever, due to risk of infection. Symptoms of acute chest syndrome, including chest pain, cough, fever, and shortness of breath. Signs and symptoms of a stroke, such as sudden weakness, numbness of one side of the body, confusion or trouble speaking, seeing, or walking. Priapism. If you experience a priapism lasting 4 hours or more, go to the hospital. Sickle cell disease is a chronic, lifelong disease. Consult your doctor regularly, depending on your age. Your doctor may recommend medication or transfusions to reduce symptoms and control complications, as well as regular vaccinations. Pregnant women with sickle cell anemia are at increased risk of problems. If you are pregnant or planning to become pregnant, talk to your doctor.